Shall we go and have a look at our patient?
Yes.
Right. Okay, let's go across there. We've got Georgie. Georgie is an osteopath and is involved with IDD assessment in my clinic. So, Georgie, thank you for volunteering this evening.
Welcome.
Show us what you would do in clinic.
Okay, so let's have you standing, Georgie. So before the patient gets on the bed, I'm just going to have a quick little, obviously we do our observation exams and all that sort of stuff and look at the spine and spinal curves, that goes without saying. But with regards to particularly what we're looking for IDD, in this position, I want to have a quick little look at what her power is like in her legs. So if we can get you to stand on tiptoes for me, Georgie, and then just walk forward and backwards for me. Brilliant. Okay, great. So we know that the S1's there, looking like there's no issues with that. And then that's it, and back down. And now I should do the same with your heels, walking on your heels. So again, now we're testing the L5, myotome, brilliant. And then come back.
So what do you do when you think, oh, there's a problem with L5, but that didn't show up on the MRI?
Well, exactly. So this is what I'm saying. So if you've got that report, if you have that report, it doesn't mention the L5, and we see a finding like this, then we're suspicious. Oh, maybe there's something that's not being mentioned, or we're not seeing on the scan. It's quite rare for that to happen, I would say. But yeah, absolutely. This is where you've got to be inquisitive the whole time.
Okay.
You know.
But quite often you might see a problem on the MRI which isn't reflected in your.
That's right. It's more likely to be that way round than this way round, I would say. Yeah. Okay. The next thing I would do is I'd ask you just to do a little bit of a squat for me, Georgie. That's it. And then I just want you to try and take the weight on one leg and then the weight on the other. Brilliant. Okay. Now the reason why I'm doing that is because let's just say we had an L3-4 nerve root compression, and if we're then asking the patient to resist with our hand is generally a lot weaker than the patient's leg. So again, I've had it in clinic sometimes where you think there's no deficit, no issue, but you get the patient to bear their weight, which is a lot more, power, and then you can see something. Okay, they're a bit weak on one side than the other, for example. Yep. So it's just a better test, I would say, doing it that way than lying the patient.
I've never seen it done that way before.
Yeah.
Is this one you've invented?
It is one I invented, but because my initial I had earlier in the year, and it was only showing on that particular test. So you could test my leg extension power. So I won't go into it, but long story short, I ended up with a spinal fusion, as you know, earlier in the year. I had an L3 compression, and if somebody tested my power of my legs, they couldn't notice it, but I couldn't go up down the stairs on one leg, and I could feel it, and that test was positive.
Right.
Yeah, so if I went down before my surgery, I couldn't take the weight. I'd collapse like that. But if you test me clinically in the clinic and you're pushing against my leg extension, it seemed strong as with the other side. But when you did that, it wasn't. So that's why I always include that now with my patients. Okay, so having done that, having done our myotomes, we'd probably then just want to look at we didn't ask the patient to do a hip flexion. Probably get to just to pull her knee to the chest. Okay, nice and strong, brilliant, and then down, and then the other side. So we look at the upper nerves now, upper lumbar, and pull, brilliant. Thanks, Georgie. And then I would also want to have a look at the reflexes. So we'd just do L3-4 again. Good. And then I'm probably going to do. I would normally I personally come around the other side, but just obviously for the demonstration on the camera, I'd want to do something similar. So we'd do something like this. Good. Okay, and then we're going to do just the ankle jerk. And then the same thing on this way. So I'm not showing you very well with the camera. And also, obviously, want to include, whilst we're here, just the Babinski or plantar response. That's perfect. And then I would also just do a quick little sort of light touch sensation. So can you feel that okay, Georgie? All the way down, feel the same into the legs as well?
Yep.
And the toes, and up and down here.